video of understanding basic ECG videos. Today, we will explain the cardiac axis. ECG is recording of the electrical activity of the heart. We explained previously that the heart impulses are forces in direction, which we called it vector. So the axis is the mean electrical vector, or the mean direction of the QRS vector during ventricular depolarization. So if we take the mean of such electrical impulses forces in the ventricles, we call it the cardiac axis. And in normal heart, the electrical current usually flows downward and leftward, and the causing of going towards the left, that the left ventricle is electrically dominant as it has thicker muscle bulk rather than the right ventricle, causing it to have more electrical activity. Cardiac axis determination is important as it can point at certain pathologies happening in the heart. So, for example, this is the normal axis, leftward and downward, but it could be deviated in cases like hypertrophy. So, if there is right ventricular hypertrophy increasing the muscle bulk of the right ventricle, this will lead to right axis deviation. But if there is left ventricular hypertrophy, will lead to left axis deviation. I want to revisit here the hexaxial diagram, which I explained in the ECG leads video. So if we try together to draw this diagram, as you can see, lead 1 is in this 0 direction, so it will be here, and then lead 2, it will be at positive 60 degrees, and lead 3, positive 120 degrees. So you can see it here, lead 3, 120, and lead 2, 60. And then if we add AVL minus 30, AVF plus 90, and AVR minus 150, this will give us this diagram. This hexaaxial diagram assigns a specific degree angle to each lead viewpoint, and it creates a 360 map to plot the cardiac axis. Lead 1, as you can see, at 0 degree, and AVF 90 degrees. So this is the hexaaxial diagram, and the normal axis lies between minus 30 to positive 90 degrees. This is the normal axis. QRS axis that falls between 30 degrees, minus 30 degrees, and minus 90 degrees, we call it left axis deviation. QRS axis that falls between positive 90 and positive 180, it is right axis deviation. And if it is between minus 90 and plus minus 180, we call it extreme axis deviation. So we have normal axis, minus 30 to positive 90, minus 30 to minus 90, it is left axis, and 90, positive 90 to 180 is right axis, and minus 90 to plus minus 180 is extreme axis deviation. How to determine the cardiac axis? So I will tell you a very simple method to do it. So look at only two leads, lead 1 and AVF. So if we put lead 1 and AVF like this, it will divide this circle into 4 quadrants, this quadrant and the above quadrant here, and this quadrant and this quadrant. And then look at the QRS in leads 1 and AVF. So for example, if QRS is positive in lead 1 and AVF, okay, positive will go in this direction, lead 1, and then AVF 90 degrees will go down like this, it is positive as well. So it is normal axis. And if lead 1 is negative, in this case we'll go to the other direction. So this is the negative direction for lead 1. And then lead AVF, if it is positive, this is the positive direction. Here, this is right axis deviation. If lead 1 is positive, but AVF is negative, oh, I will not go in this direction. I go to the opposite because AVF is negative. So this will lead to left axis deviation. And if I have negative lead 1 and negative AVF, this will give extreme right axis deviation. So as you can see, straightforward, if 1 and the AVF QRS complexes are positive, this means normal axis. And if both are negative, this is extreme axis. And then right and left axis depends on one positive and one negative of the 1 and the AVF. But we have a problem here. If we have positive lead 1 and negative AVF, it could be left axis deviation, but still we have up to minus 30 to be normal axis. So how to know this? As I said, if you have positive QRS in lead 1 and the negative, you will go in this direction. So either you are in the normal axis area or in the left axis deviation. How to know? In this case, the second step, you look at lead 2. And if lead 2 is positive, this will take you towards the positive side, which means it would be normal axis. If lead 2 also is negative, like the AVF, it would be left axis deviation. We can call it like three-step axis algorithm. So evaluate lead 1 and AVF. If lead 1 and AVF both are positive, in this case, the axis is normal, between 0 and 90 degrees. And if lead 1 and AVF, both of them are negative, this gives extreme axis deviation between minus 90 and 180. If lead 1 is negative and AVF is positive, this gives right axis deviation between angles 90 and 180. If lead 1 is positive and the AVF is negative, we have one of two possibilities. Either it is normal axis between 0 to minus 30, or it is left axis deviation. In this case, look at lead 2. If positive, this is normal axis. If negative, like the AVF, in this case, it is left axis deviation. You may ask an important question: how to know if the QRS is positive or negative? So simply, it might be straightforward like this. If you have very high R and small s, this is positive. If you have small r and deep S, it is negative. If you find it biphasic, go for the same principle. If the R wave is higher than the S wave, it is positive. If the S wave is deeper than the R wave, it is negative. We get brief idea about how axis deviation can point at abnormalities and underlying pathologies in the heart. Of course, this should be interpreted with QRS morphology, clinical context, and the rest of the ECG. It could suggest ventricular hypertrophy. In left ventricular hypertrophy, we find left axis deviation. In right ventricular hypertrophy, we find right axis deviation. Also, in fascicular blocks, you know that the left bundle is divided into anterior fascicle and posterior fascicle. So left anterior fascicular block gives left axis deviation, and left posterior fascicular block gives right axis deviation. Also, it could suggest pulmonary pathology like pulmonary hypertension, pulmonary embolism, COPD, in which you find right axis deviation. Also, it can point to ventricular rhythm when the origin of the impulse happens outside the normal conduction system, and this will throw the axis into extreme axis deviation like in ventricular tachycardia. Let's test our knowledge at the end. What is the axis in this ECG? So if we apply what we learned, we should look at the QRS in lead 1 and AVF. So in lead 1, I can see the QRS is positive. In AVF, I can see it is positive. This means that this is normal axis because the QRS complexes are positive in 1 and AVF. Let's summarize and take home message. The cardiac axis normally is between -30 to +90, which is normal axis. -30 to -90, it is left axis. +90 degrees to 180, it is right axis. And extreme axis between -90 to 180. How to determine the axis? Look at the QRS complexes in lead 1 and AVF. If both are positive, this is normal axis. If QRS is negative in both leads, it is extreme axis. If it is positive in lead 1 but negative in lead AVF, it could be left axis or could be normal less than 30, less than -30. And in this case, you need to look at lead 2. If it is positive, it is normal axis. If negative, will be left axis. And if lead 1 is negative and AVF is positive, it is right axis deviation. Next lecture would be important lecture because it will summarize all we have learned about the normal ECG and will get a scheme to how to read the ECG.